Welcome back to another one of my videos where I'm demonstrating advanced podiatric intervention for foot and ankle sports injuries. This lovely lady here has an osteoarthritis to her ankle joint and the anterior facet of her subtalar joint. I am performing an ultrasound guided corticosteroid and hyaluronic acid injection under local anesthesia by ultrasound guidance. You can see here that I'm using a connecting tube, so this way we can administer all three elements of that injection, local anesthetic, corticosteroid and hyaluronic acid, through one needle. First, the connecting tube is preloaded with local anesthesia. And this enables the injection to go smoothly with little to no pain. Now here you can see I have used ultrasound guidance to administer the needle to the sinus tarsi to access the subtalar joint. As those of you who have seen my injections before, the first thing to go into to the foot is the local anesthesia, then there is some corticosteroid, and then the hyaluronic acid. Now I'm doing two injections here, and if we flush the line, which is important to ensure that all of the pharmaceuticals have entered the joint and none remain within the connecting tube, which is about a 1 millimeter in volume in this case, I have flushed the line with local anesthesia. This means for the second injection I can administer the local anesthesia initially within the connecting line without having to reload it. Obviously for the second injection we always use a fresh syringe. We can see the line has a lure lock here, a twist lock on, which enables a secure fitting for injections of high pressure, and sometimes hyaluronic acid injections through a 25 gauge needle are higher in pressure. I always use sterile drapes to enable a sterile field when we're doing these injections. Usually we would take a very lateral approach to an anterior ankle injection, but in this case, because of a large lateral joint line osteophyte, we're having to take a slightly more central approach. We are using the ultrasound here to visualize the extensor tendons, blood vessels and nerves to avoid piercing these with the needle. As we can see, this injection is slightly more difficult, both avoiding all the soft tissue and accessing the joint than it was through the sinus tarsi, which is much larger. But with ultrasound guidance we can see that the needle is within the joint capsule. The line, as I said, was preloaded with local anesthesia, then corticosteroid is applied through this. This is the most comfortable way of performing this injection, and the patient is, in all honesty, completely pain-free throughout this process. Hyaluronic acid is now being applied to the line, and there's slightly more back pressure when applying this. And sometimes towards the end of these injections, patients can start to feel a tightening of the joint. In total, probably approximately 4 to 5 millimeters of fluid is applied to each joint. I'm flushing the line again here. We know that the line is completely clear of hyaluronic acid when we notice a giving in the syringe, where the back pressure reduces significantly. And you can see here it happened just now. Thank you for watching my video. If you like this, please like and subscribe to my channel, where more videos will be following shortly.